Hey everybody, and welcome back to the Mindful Health Podcast. I am your host, as always, Dr. Jordan Cardoza, physical therapist. Today we're going to be talking a little bit about the quad muscles, kind of why they've been demonized a little bit in the rehab community over time, and why we should actually be using them and strengthening them to help our patients out, whether it's just for strength training or just overall knee health and or knee pain that they're dealing with. I think that can be very important. So when I was going through school, there was starting to be a shift in the rehab community from, it used to be that for knee pain and lots of knee pain, the goal was always to strengthen the VMO, which is basically the inside, the kind of middle of your quad, or the middle side, the medial side, we would call it. Towards the end, there's a piece where the muscle fibers start to run more side to side instead of up and down. And this area is known as the VMO. And there was a lot of talk about strengthening the VMO, how to bias the VMO so that you can target that to help with your knee pain. And the thought was that with knee pain, the patella was tracking incorrectly. It was going off to the side, so that by using the VMO, we could use it to hold the patella back in a better place. So that used to be the old thought. When I was going through school, it transformed to all about the glutes, and the thought changed from versus that, which is kind of like saying, we're going to fix the train, but not the train tracks, which would be the bone underneath it, the femur. So the theory of the glutes is the knee would be going into a valgus position, and because of that, the patella wouldn't be tracking right. So we're going to fix more of the track of the railroad so that the actual train can go straight, and that's going to help knee pain. And I do think that's a better kind of analysis of it as far as that goes. Just by kind of the mechanics and everything, I do think that's better. And the thought that we're not going to be able to bias just one little piece of the quad, when in reality, if we just strengthen the whole quad, we'll be better. But the swing came so, at least in the area that I was learning and kind of reading, it went so far that the quads, it seemed like we're almost demonized, like nothing should be quads. Even in school, we were taught to teach people how to squat, to bias the glutes, and we were almost like teaching people to turn off their quads, right, and only use their glutes for these movements, when in reality, right, a squat is a squat pattern, so that is going to be a more quad-dominant motion, where a hinge, which is more of a deadlift or an RDL, that's going to be more glute-biased versus a squat, which is going to be more quad-biased. And obviously, in all these motions, you're getting hip extension, you're getting knee extension, so you're working both of them. It just kind of depends what you're biasing a little bit more. So when I was in school, we were almost learning to not use the quads hardly at all and focus all on glutes. From what I can remember and what I saw a lot in the clinics, everything was glute-based, right? We were almost avoiding quads because a lot of people did have a quad-dominant jumping pattern, right, which is normal. But they're having a lot of knee pain just because those tissues weren't ready to adapt, weren't ready to accept those loads. And there are a lot of people who are over knee dominant, and that does contribute to some of their pain, right? But pain is multifactorial. But I think we went the other end by training, you have to jump a certain way, you have to land a certain way, and we're making it very kind of robotic and structured like so. But if you look at it, a lot of the best athletes, when they jump, right, their knees go over their toes. They are very quad. It's like a balance between quads and hips, right? But I feel like in the rehab community, we swung too far towards the hips when somewhere in the middle there would have been a nice combination. I do think that for overall knee strength, knee health, if you're dealing with knee pain, strengthening the quads and teaching proper movement can be a great way to help with that. The stronger your quads are, right, the better, just the stronger your overall lower extremity is going to be. Am I going to strengthen the quads, the glutes, the whole lower leg, right, depending on what you find? Of course, but I think there's too many people that don't work on the quads, and I think they're very important. So, I'll give my patients compound movements that'll work on the quads. I do a lot of quad work myself, as well as some eccentric quad work. So things like that. So I think training the quads is very important for, like I said, just overall athletic ability as well as knee pain. The knees over toes guy, if you guys have ever seen his stuff, you can look him up. He has a lot of great content on knee health. One of the things that he recommends a lot of people for knee health, and I think it's actually real beneficial, is a backwards sled walk. And in that motion, what's nice about it is you can load it from doing nothing, right? Just walking backwards, which anyone can do, all the way to loading it with heavy weights. The nice part about it is there's no eccentric component, so it's a little bit, eccentric components are typically give a little bit more stress to the muscle and the bones, but it's a very safe movement because you're not having to work about the eccentric. So in a squat, right, if you have an older patient or someone who's weak, they have to worry about getting it down, so there's a safety component to it. With a backward sled walk, you don't have to worry about that. You can get a great workout in with your quads. It's a safe movement. You do get a little bit of your knees over your toes as you're walking backwards, which is perfect. That's a functional movement, right? It happens in everyday life. So my philosophy is that if you're always training in the perfect positions, right, then you're going to be weak in those positions when you do get into those during regular life. So I think it's important to train knees over toes. I don't think there's anything wrong with it. I don't think it's going to blow your knees out or anything like that. I think it's normal as long as you adapt to it over time. I'm able to do some fun movements, to show off mobility or strength or things like that, but it's not like someone should do that right away. You have to build up to it over time. So I do think the quads get a bad rap for knee pain, right? Causing knee pain. You're quad dominant instead of glute dominant or hip dominant. So I think it gets a bad rap, but I think it's very important that you do work on strengthening those areas as well. And I think you will get good results. But overall, don't demonize the quads. They're a good muscle. They need to be strong just like anything else. They are useful in rehab as far for pain goes, as well as just overall athletic ability. So if you don't feel like, right, that when you're squatting, you have to turn it into a hinge, you have to turn it into a glute movement. As long as you're balancing your hip work with your knee work, right, your quad work or your glute work, as long as you're balancing that within your workouts and you're not only doing quad work, then you're going to be fine. And you can adapt to more progressive things over time as well with your knees, just like any other muscle, any other joint. Progressive overload is kind of always the key for that. So if you guys have any questions, let me know. But I just wanted to kind of get that out there because I get that a lot with quads are bad, knee pain is bad. So I see it a lot kind of online as well. So hope you guys enjoyed it. If you have any questions, let me know, and I'll see you next time.